I'm Zach Dyce, a Florida man born and raised right here in Orlando, and I'm the founder of Penguin Health. We build compliance and quality improvement software purpose-built for Medicaid behavioral health and safety net providers. These teams are being asked to do more with less, while regulators and payers are tightening oversight. Most providers still rely on manual chart audits, spreadsheets, and after-the-fact reviews, meaning that most notes are never actually reviewed before billing. As a result, risk is invisible until it becomes a denied claim, lost revenue, an audit finding, a fine, or more work for already overstretched staff. That's where Penguin comes in. We're building an AI-assisted note and chart auditing platform for quality, compliance, billing, and finance teams. We work with EHRs. We review notes against payer, regulator, and program rules, flagging these issues before they compound. The goal isn't to replace staff. It's to help staff stop hunting for errors manually and focus on what humans do well: judgment, coaching, follow-up, and care improvement. And we're starting with the compliance and quality teams. These are the people already spending hours opening charts, checking notes, documenting findings, and chasing corrections. We give them a clean queue and workflow of what actually needs their attention. And then we can work with billing teams to catch issues downstream before they become denials. We can work with clinical supervisors to give them better data and evidence to coach staff. And ultimately, patients benefit because care continuity depends on financially stable providers with staff that are focused on care and not admin. And this is a low-lift integration. We work with you in your EHR. Weeks 1 and 2, we'll sign a BAA, figure out workflows, and configure the first audit rules. Weeks 3 through 8, and maybe a bit beyond, we actually work through and start implementing this in practice. We iterate in real time. Then by weeks 9 to 12, we have a good idea of what's needed, and then we'll start to put together the findings and make the case of what the real savings and values are. One that we've already seen is that we're saving teams 15 to 20 hours a week just on quality audits. This is audits that provide 100% coverage. We increase your compliance score, we reduce denials, and ultimately, more patients are being served. So all we ask from you is that we need you to provide staff on the data side. We need a program officer. We need one weekly meeting to make sure that we're getting the most out of it, that we can make adjustments on the fly, figure out where the biggest impact can be had. And we'll run this through our system, which is secure. We use AI responsibly, and we have a clear exit plan to where you keep the findings. You can keep doing this if you want, but ultimately at the end of the day, we're here to build for you and for the patients. Thank you.